Hi, I'm Dr. Lynn Wagner, and welcome to Doc's Thoughts. Today, I'm going to spend some time talking about men's hormone optimization. It's something we don't talk about as often, and I think we're doing a huge disservice to men, not giving them the information they need to know what they can do for their health. I see it all the time where I have women patients who I've seen for years, and they say to me, "Oh, Dr. Wagner, I wish my husband would come and see you. I feel so good." And sometimes they do. So a lot of times I do get to see their husbands eventually, but it just takes a lot longer for them to get in our doors. And there's a lot behind that story. We're used to going to the doctor as women. We have babies. There's lots to deal with as a woman in our bodies, and men don't have to go in as often. And so it's just not as natural for them to seek medical care when things just don't feel right. And I would say men also just don't know that things don't feel right. The natural process of aging is so slow and so gradual that a lot of men will gradually lose these functions that they don't even notice it. And one day they'll just be like, wow, I just feel terrible. And it was such a gradual, slow process that they didn't think to seek care in the middle of it. And I can tell you, it's a lot easier to back things up when you start treatment or looking into options sooner than it is to do it when it's a little bit further down the road. So getting to the point, I'm going to talk about men's hormone optimization, mostly about testosterone therapy. There's obviously other parts of the picture here, but I want to spend most of my time talking about testosterone because that's kind of the hot topic. One thing I'll tell you as well is if you're a younger male, I would also just listen to this whole episode because there's a lot of things you can do as a younger man, even if your testosterone levels aren't low, that can offset that natural progression of testosterone loss as you get older. So this episode is actually super important for you too, because it can delay your need for using medication or testosterone replacement till later on in life, which is actually ideal. The other thing to talk about is what are hormones in men. So there's so many hormones in all of us, men and women. Specifically today, we're talking mostly about testosterone, but there are other sex hormones that men produce. Men produce some forms of estrogen. Men produce progesterone. Men produce DHEA, which is the precursor hormone to testosterone. Men have DHT hormone, which is actually produced by testosterone. And then there's a hormone called pregnenolone. That's not all of the hormones a man produces, but those are most of the sexual hormones that a man produces. And they're all important. And so it's really important when you work with someone who is looking at your testosterone levels that they're not just slapping you on an injection and giving you some Viagra and sending you off into the night, because these things all work together. And if someone's not looking at the whole picture, you're really not truly getting optimized, and you could potentially have some complications. So that's a really important thing to look at as well. What is the natural progression of men's testosterone? So men usually peak in their late adolescence, early 20s. So that's when your testosterone level is at its highest. It's not the same for everyone, but that's about the average. And then as men get into their late 20s, early 30s, they'll start to have a decline in their testosterone levels. That's just a natural process of aging. In their 40s, they might start to actually notice symptoms of testosterone loss, and we'll talk about what those are later. And then later on in life is when the levels can get pretty low, and men can have some pretty significant symptoms associated with their low testosterone levels. For years, we have done nothing about this, nothing. And there are a lot of doctors who still do nothing about this. We've been doing testosterone replacement and other forms of testosterone optimization at Wagner Integrative Health for years now. And I can tell you it is absolutely life-changing. As a physician who's a healer who really just truly wants to make people feel better and be at their best, it has been a huge game changer in my practice. And that's why I really want to talk about it to all of you. What are the symptoms of low testosterone? I'll talk about the symptoms and then the improvement you would expect to see, because they kind of go hand in hand. So one of the biggest is just a general feeling of fatigue. So some people will come in and they're just like, everything's fine. I'm sleeping fine. Everything's going well, but I just feel really tired all the time. So low energy levels is a big one for having low testosterone. So then obviously if you are optimizing your testosterone, you can expect improved energy, improved vitality. Some people experience mood changes. So a woman will say, gosh, my husband just seems really moody or kind of depressed or funky, or he has lack of motivation. And those are very classic with low testosterone levels. And so when you optimize testosterone levels, man will experience that increased sense of motivation and wanting to get things done. And it's part of that whole vitality. And oftentimes, if they were a little depressed, that depression will resolve. Or even if they were a little bit anxious, that anxiety will resolve. So there's a lot of a mood connection to testosterone levels. And then obviously there's the sexual part of testosterone. So lower libido, difficulty with erections, and those things can improve with testosterone therapy. What I see is that everyone thinks that testosterone is all about erections, and there's nothing further from the truth. It can help, but there's such a huge bigger picture to the story, so that we need to talk about that as well. And then body composition is huge. So we call it menopause in integrative medicine. So it's similar to women in menopause. Men grow through this natural progression as they get older with their hormones, and we call it menopause. And a body composition in a man will change where he'll build up more body fat and decrease lean muscle mass as he gets older, and that's very much driven by testosterone. And so if you optimize a man's testosterone, he's going to have increased muscle mass and decreased body fat, as long as he's living a healthy lifestyle in addition to that testosterone replacement. So testosterone is not a cure-all where you can do whatever you want and just take a shot every week and melt off body fat and gain muscle mass. That's just not going to happen. I'd be a billionaire if I could figure that one out, but I really don't want to. But basically, if you're pairing testosterone with a healthy lifestyle, you're going to see an improved body composition. And then mental clarity and brain fog. So a lot of men with low testosterone levels will just start to feel like, my brain just doesn't work like it used to. I just feel kind of slow, foggy, and that's very much testosterone driven. And so if you optimize his testosterone levels, he'll experience improved mental clarity, focus, ability to do things that he used to do, which is obviously a big deal. And then this is more of a benefit of testosterone therapy, and it's slightly controversial, I would say, but we used to say there was a huge black box warning about using testosterone in heart disease. And yes, if you have existing heart disease, existing heart failure, known coronary artery disease, you need to talk to your doctor before you initiate testosterone therapy. It's not 100% contraindicated. But on the flip side, there are studies showing that a man who uses testosterone replacement may have lower risk of heart disease. And if you actually think about it, it makes a lot of sense, even if you don't do a scientific study on it, but there have been those. But basically, if you take a man and you optimize his body composition and you improve his energy and vitality and mood, obviously his cardiovascular health is going to be better because he's going to be losing the fat, building the muscle, doing the things he loves to do, all those things that will decrease inflammation in the body and obviously decrease risk of heart disease. So that's a cool thing to think about. And then other than aging, let's talk about things that can decrease your testosterone levels. So aging aside, poor diet and lack of exercise. And the reason for this is the obesity that it contributes to. So if you're someone who has a poor diet and an inflammatory diet, eating a lot of processed foods, unhealthy fats, high in sugar, or if you're not doing any form of physical movement, you are going to have naturally lower testosterone levels. And that's why doing those things can increase levels and are really important. And the other thing is a poor diet and a lack of exercise will lead to obesity, which then obviously will decrease testosterone levels as well. Sleep deprivation. So sleep is one of those under talked about things in our health and wellness world. And I'm huge and all for healthy sleep. So when you don't get healthy sleep, you will decrease your testosterone levels. And an adult needs between 7 to 9 hours a night. It really depends on the individual, but on average, 7 to 9 hours a night. And it's not just the hours you spend in bed, it's the quality of that sleep. So you have to be getting enough deep sleep. You have to be going through all the sleep cycles. It's important to wake up feeling rested and refreshed. So if those things aren't happening, those can negatively affect your testosterone levels. Inflammation and chronic disease. So that kind of ties in with the obesity and the lack of exercise and the poor diet. They're all tied together. It's not just, nothing's a silo. But if you have an inflammatory disease process, that can negatively affect your endocrine system, which is where testosterone is basically housed. It's in your endocrine system. So having chronic disease states can affect testosterone levels. You obviously can have hypogonadism as a primary disease, which causes low testosterone. I'm not really covering this here. I really want to talk about lifestyle things that can affect testosterone levels. Certain drugs and alcohol can affect testosterone levels. So if you're a really heavy drinker or daily habitual drinker, this will lower your testosterone levels. Certain drugs like opioids or corticosteroids. I don't know if there's a direct link between THC and testosterone reduction. I'd have to look that up. I know there's a correlation with sperm reduction, but certain drugs can lower your testosterone levels. So if you're a chronic user, that's going to affect you negatively. There are certain prescription medications that can affect testosterone levels. Again, that opioids fall in that category. Stress can affect your testosterone levels. So whether it's physical stress that you're being exposed to that's harmful, or if it's emotional or psychological stress, those things can create a reduction in your testosterone levels. And then also something we don't talk about that often is environmental toxins. And I see this problem in women a lot, where we see women with estrogen dominance or problems with their cycles. And part of this is things we're being exposed to in our environment, things that sometimes we can't control or things that we can control. So that's things like BPA, plastics, but it also includes pesticides and fertilizers and things like that, which I'm not going to go into detail during this episode, but something to think about. And so if you're someone who's wanting to start working on protecting your existing healthy testosterone levels or possibly even boosting yours, those are all things to think about. And if any of those things are true to what you're doing in your life, you want to start kind of backtracking and getting away from as many as you can as possible without being perfect. And then there's other natural things you can do to boost your testosterone levels. So I'm not all about injections and drugs and, just forcing the issue. I love the drugs when I need them, and I need them often. But some things you can do that might naturally boost you a little bit. They're not going to be as strong as taking a shot or something like that. But things like weight training, strength training, there's been studies that show that yoga can boost testosterone levels. And that's probably through a combination of the muscles that you build along with the stress reduction that happens with the yoga practice. Even some cardio, although not too excessive. So that's a double-sided coin, because people who do very, very excessive amounts of aerobic exercise, so maybe you're like an Ironman or excessive biker, you can actually have reduction in your testosterone levels. But a healthy amount of cardio activity can be really, really good for your testosterone levels. Obviously, getting healthy sleep, which we covered already. Eating healthy, which we covered already, which can lead to a decrease in body fat and less inflammation, reduction in alcohol or any other drugs that might be affecting your testosterone levels, stress reduction, obviously. And there are supplements that you can take to boost testosterone levels. I would say in my experience, they are obviously not as strong as taking the real deal, but they can be a nice adjunct. And so if you're someone who's kind of on the border, or you're younger and you want to protect your healthy testosterone levels, there are supplements that can be used. So things like zinc, boron, Tongat Ali, Fadoja. I'm not going to give dosing or regimens or anything like that, because those really should be recommended under the direction of a medical practitioner, not someone online and not a health coach. Nothing against these people, but if you're starting to mess with your hormones, you really need to work with someone who knows what they're talking about. So I'm not going to give specific instructions on how to take those things, but there are some supplements. I would just be careful, because if you go to a nutritional store, if you go online, there are hundreds and thousands of supplements available meant to boost males' testosterone and improve their vitality and their libido and their erections. And most of them are a pile of crap. So you are going to waste your money and potentially take something that can harm you. So you just really want to be careful when you're looking at all the options that are out there, because there are some really good ones, and there's a lot more really, really bad ones, all developed by people who would want to make a lot of money. And then let's talk about actual treatments for low testosterone. So first of all, you have to look at your levels. So don't ever start doing a therapy if you haven't actually looked at where you're starting from. So it's really easy to get your testosterone levels checked. You can get all of the other hormones levels checked as well, which I would recommend that you do. And then you can look at where you fall in the range. So man's testosterone is reported out as either total testosterone or free testosterone. Total testosterone is the amount of testosterone that is in your body, that totally is in your body. Free testosterone is actually the amount of testosterone that you can use, because part of your testosterone is actually bound up to a protein called sex hormone binding globulin. Also, there's albumin. So some testosterone gets kind of stuck onto this little protein that floats around in your blood, and it cannot work in your body. It can't hit receptors. It can't do what it needs to do. It's part of the total volume in your body, but it's not actually usable at that moment. And so you really need to look at both your total and your free testosterone levels. In our clinic, we actually calculate free testosterone levels by measuring albumin, measuring sex hormone binding globulin, and measuring total testosterone. And then you can do a calculation to get the male's free testosterone level, because that's the level that actually matters, because that's what you can actually use. And the range is pretty big. And you might go to your regular doctor and say, hey, can you check my testosterone? And they'll say your testosterone is fine. But if you look at the range, if you're in the bottom third of that range, at our clinic, we consider you to be low, because I say this about vitamins as well. You really don't ever want to be at the low end of a range. You want to be either in the middle or more towards the high end for most things, not everything, but definitely for testosterone. And so if you're someone who's walking around in that lower third of the range and your doctor is telling you, oh, you're fine because you're normal, it's kind of like having a vitamin D level of 31 when the range is 30 to 100. We want to keep people somewhere between like 50 and 70 or 80, I would say, for vitamin D. So if your vitamin D is 31, that's really not that optimal. So you need to work with someone who thinks about things a little bit differently than a lot of our Western medical colleagues do. So let's talk about treatment options. So this is where I really love to, work with the patient and kind of create the best plan for them. First thing to know is that testosterone therapy is something that if you start, you most likely will have to do long term if you want to have those benefits that you get from taking the testosterone therapy, because you're basically replacing what your body isn't producing and potentially even reducing what you were making. Testosterone, basically, you're just giving it to yourself. It can actually result in a decrease in what your testicles are producing and a little bit of testicular shrinkage. So not to scare you off from it, but it's a commitment. If you decide to start testosterone replacement therapy, I would look at it as a commitment for life. Several providers will say, oh, you can go off of it and everything will go back to normal range. And that most likely is what will happen. But when it comes to fertility and when it comes to something you're going to have to do for the rest of your life, I would look at it more like a commitment that you're going to do for life. Testosterone replacement is really, really easy. For most men, it's an injection that they do once a week, and they can do it into any major muscle group. A lot of them do it in their butt or their thigh. A lot of men have their partner do it, which is totally fine. And you do it for a week because the most common drug we prescribe lasts for a week in the bloodstream. So you can just do this one injection. You'll get a nice level of testosterone in your blood. And as it gets time for your next injection, it will start to go down. And that's when you get your next injection. Some of my patients will do twice a week dosing because they don't want to have that drop towards the end of their week, which is totally fine. You just split the dose up in half and give yourself an injection twice a week. The prescription comes from a pharmacy. You get a vial of medication, you get syringes and needles, you learn how to give yourself an injection, and it's actually pretty easy from there. And that's really the most straightforward way to replace testosterone. There are also cream options available for testosterone replacement. And with cream, you actually apply the cream, or there's gels to your skin, and you get transdermal absorption of that hormone into your bloodstream. I would say you can never get as high of a dose in your bloodstream with cream as you do with an injection, but a lot of men do find that the creams are fine if they really don't want to give themselves injections, or if they don't really need that much of a replacement. It's a nice option as well. There are also hormone pellets, or some people call them seeds, where you have to come into the office every 6 months and you get some pellets injected into the fatty tissue of your butt. That slow release over 6 months. Those are a lot less common. Men need quite a few pellets. Like I'm talking like 6 to 10 pellets to get to that maximum dose. So it can be kind of cumbersome, and they can have kind of a lot of pellets in their butt, not up their butt, but in their butt. And so most of our patients will do injections or cream. And we'll talk about, possible side effects and negative things with testosterone later, because everything I'm going to talk about can cause some of these negative side effects. So I'll cover that at the end. The other most common options I use for testosterone enhancement, and this isn't replacement, this is enhancement, are HCG, otherwise known as Pregnol, or Clomid. So I'll start with HCG first. So HCG is actually another shot. Instead of just replacing your testosterone, HCG actually stimulates your testicles to make testosterone. So it's actually a beautiful drug to use for someone who wants to maintain their fertility, because testosterone will decrease fertility in a younger man. So we very, very rarely use straight up testosterone in a younger man who's still desiring to have kids. HCG, on the other hand, it mimics this hormone called luteinizing hormones, and then the luteinizing hormone stimulates the testicles to make their own testosterone. So you obviously have to have testicles that can make testosterone, or this won't work. But if it does work, it's really, really nice. The downside of this drug, it would be wonderful if there weren't any downsides, but it's quite a bit more expensive than testosterone, and it's more frequent dosing. So you have to dose it twice a week for sure, and not just once a week. I actually have some patients who will use both. So in a man who either doesn't want to have their balls shrink, or a man who, wants to keep doing some of their own testosterone production naturally, will alter both testosterone therapy with HCG. You just use lower doses of both of them, and that works really well as well. And then another drug that I use, not as common, but there's a drug called clomiphene, or Clomid. And a lot of you will have heard that drug if you've been through any type of infertility. It's used in women to stimulate ovulation. In a man, it actually stimulates FSH and LH, which then go on to stimulate the testicles to produce more testosterone. That one is a little bit nicer in that it's cheaper. You can get it at the regular pharmacy, and often it's covered by insurance. It's usually dosed every other day, and the dose just kind of depends on what your levels look like. So you start the medication, we monitor your levels, and then we can adjust it. I have seen some more issues with that drug causing elevation of other hormones more than we want. And then you have to start giving estrogen blockers, or you have to giving, different medications to offset those other increases in hormones. So it can get a little bit more technical, but it is a really, really nice choice. And similar to HCG, it does not affect your own testosterone production. So it won't affect your fertility. So you will still be making your own testosterone levels. So if you desire to have children and father children, it shouldn't be a problem. So those are really the big ones that we use. What are the things to watch out for? So this is another thing that I don't think people talk about enough. I have patients who come to me who are either, seeking their testosterone replacement through another provider in the area, or they were getting it online, and I'll check their levels and they're like double the high end of normal for a man. We're not about making weight, weight competitors here. If you want that, you probably should go somewhere else. But I'm here to tell you that increasing your testosterone levels far beyond the upper limit of normal is where you start to have side effects. So there's the bothersome side effects of acne or hair loss. But you have to look at things like high estrogen levels. So testosterone can convert into estrogen, and that's when you start to get some feminization of male, whether it's man boobs, we call them, or gynecomastia, or breast tenderness, fluid retention. You'll start to see the side effects of that other hormone that testosterone can convert into. Testosterone can also convert into DHT, which directly can cause hair loss. Some DHT is great. DHT is a wonderful hormone, but you really have to look at how high it's getting. And if it's getting too high, you want to kind of like correct that a little bit. The other thing that we look at often in a man who's on testosterone level is we check their PSA, their prostate surface antigen level. And if that starts to go up, we'll refer them to urology, and we check their hematocrit. So a known side effect of testosterone replacement is actually an increase in your hematocrit, which is part of your CBC or your blood count. And that's almost like a thickening or sludging of the blood. You can get a pretty high hematocrit without it being dangerous, but we monitor it. And if a man starts to get above a certain level, it's a pretty simple fix where they literally just go and give blood every month or every 2 months and give away some of that extra blood that they've created. So that's a known side effect. It can also be a benefit. So if a man is anemic or not making enough blood, it can actually stimulate blood production. So there's kind of two sides to that one as well. And then another one that I really want to talk about. So we talked about testicular shrinkage a little bit. That's just if you're a testicle model, maybe that matters, but most guys don't care about that. But I always counsel people on sleep apnea. If they have existing sleep apnea, testosterone therapy is not something they should take unless they're on a CPAP or have addressed the sleep apnea and resolved it. And then you have to look at your mood history. So testosterone can be kind of an aggressive hormone. So if you're someone who's already quick to anger or really irritable or anxious, sometimes testosterone can make that better, but we always counsel patients, like, watch your mood. If you start to feel like you're getting more angry or short, and we tell their wives this as well, your levels just might be a little bit too high. Now, this is a super rare side effect. I think I've literally had one patient that this has happened to, but we do counsel them on that as well. So as you can see, you really, hormone replacement isn't just a quick fix. It's a story, it's a picture, it's alchemy. And so when you're a man who's thinking about your hormones and your vitality and your health, you really want to work with someone who's going to look at the whole picture, who's going to look at not just your levels, they're going to look at your lifestyle, they're going to look at what you eat, what you drink, if you're using drugs, what your relationships are like, what your mental health history is like. And then when they recommend a treatment plan, it's not just a shot, it's things that address all of those other things as well. And if you're a younger man, the shot won't happen at all. But if you're addressing all those other things that we talked about, you're going to delay your reduction in testosterone. So you're going to delay your need to replace it. Most men, if you want to have healthy testosterone levels past the age of 50, are probably going to need to take some form of medication to get there. There's plenty of men walking around who don't do it. I wouldn't recommend it. I don't think it feels as good. But there's plenty of men who don't do it. But if you're someone who really wants to keep things optimized and keep your body as healthy and strong for as long as possible to do all the things you love to do, then testosterone is something you want to keep in your body. So the more naturally you can do that starting as a youngster, the better you're going to feel when you get older, and the longer it'll be before you actually have to take something to keep your levels optimized. And then I'm going to end with who shouldn't do testosterone replacement therapy, because there are some people who really shouldn't do it. So again, I said untreated sleep apnea. The beautiful thing about that is you can get a CPAP, you can get your sleep apnea treated. So that doesn't mean you can't ever have it. It just means you need to take care of that problem first. There is warning against someone who has prostate cancer or a history of prostate cancer. I won't discuss that in this episode, but there are doctors out there who don't believe that testosterone therapy actually increases prostate cancer. So that would be a conversation to have with your urologist if you're in that category. Any man who's had breast cancer should not take testosterone therapy. Obviously, that's super rare, but it does happen. So if you've had breast cancer, you're not a candidate for testosterone replacement. Severe heart disease. So like I said earlier, there are some studies that show a reduction in heart disease with testosterone replacement. But if you're someone who has severe congestive heart failure or severe coronary artery disease, it's really a strong conversation you want to have with your cardiologist and the doctor who's doing your testosterone replacement before you initiate that therapy. It's not a complete contraindication, but it's a conversation that needs to be had. Someone with BPH or benign prostatic hypertrophy, that's that where your prostate gets big and it makes it hard to pee. That's again something you'd want to discuss with your urologist because testosterone sometimes can make that worse. So you'll want to keep an eye on things. But again, I have plenty of men with BPH who take testosterone therapy. And then if you have an untreated mental health disorder, so like I was saying with the whole anger thing, if you have emotional or mental health issues and they're moderate to severe and they're not being managed, I probably would not recommend taking testosterone replacement at that moment. You want to focus on your mental health first and then tackle your hormones later, or maybe in parallel when your mental health starts to improve. So that was a lot of information. I hope you enjoyed it. And as always, I love to hear any questions you might have about it. Questions, additional information that I didn't cover would be useful. You can put them in the comments below this video. You can email us at the clinic, which is clinic@wagnerintegrativehealth.com. And I get back to you as soon as I can. You can also call our clinic at 920-327-7056. I'll put all these links below. But again, I really appreciate you being my audience. And, our main goal is to make you feel as amazing and vital as you possibly can so you can make all the wonderful changes you need to make in this world. And even if that just means being an amazing spouse or an amazing parent or an amazing worker, amazing business owner, it doesn't matter. You want to be your best. And in order to be your best, you really have to optimize your health. And testosterone replacement is a huge part of that. So with that being said, talk to you guys soon. And thanks for being my audience.